guys, this is Yummy Mommy and welcome back to my channel. I have a really cool guest today. He's my cousin. Please introduce yourself.
Hello everyone, my name is Dr. Christopher Obwaka, or just Chris.
Okay, I've not even heard you say your full name. Hey, watu wakikuja YouTube sasa wanakuwa Christopher.
Obstetrician Gynaecologist, based at Nairobi Hospital and at NSSF building in Upper Hill.
Exactly. So guys, you see, doctoring runs in our family. His dad is a doctor, my dad is a doctor, our dads are brothers, and then he's a doctor.
She's a witch doctor.
Wow, this is the end of the video, done. Anyway, so we thought that we would come back here and answer some more of your questions that you guys had sent me. The first video with my dad about contraceptives, and then about PCOS, and this one is all about pregnancy and giving birth. Now, Chris, let me tell you something. In like 2 YouTube videos ago, Zach asked me how many kids. I asked Zach how many kids do we have, and he said we have 3 kids. So people have been asking me, am I pregnant? Am I pregnant? Am I pregnant?
Is the third one.
And exactly. Yeah. So I've not confirmed in this video whether or not I'm pregnant. Just have to watch the very end, and then maybe I'll tell you whether or not I'm pregnant. So we're gonna answer a few questions about pregnancy and giving birth specific. And by the way, before we continue, guys, you can see this man is married. You see? He's married. I know you're thinking he's handsome, but he's already taken.
That's why I'm using this hand
exactly.
To explain.
There's some very thirsty hoes out here. Okay, so I mean, as usual, like this video if you actually like the content. Comment down below if you have any other questions if they are not answered in this particular video, and of course subscribe. Are you subscribed to my channel?
I am. I was watching your videos just before you came.
Good. Okay, let's jump into it. First question: does the vagina go back to its original size after giving birth, assuming that somebody gives birth vaginally? Yes.
Yes, it does. The vagina is very flexible, very expansile. You can imagine the baby's head is maybe 10 to 12 centimeters. A normal vagina maybe about 3 to 4 centimeters. That's more than 200% increase in the size of the vagina. But it's a very muscular, very elastic organ. So after delivery, it does go back to its normal size. The only issue is if you get tears, especially big tears that are not repaired well, then you could have a difference in the size or the tone, so to speak.
So you're saying even if I give birth to like 10 kids,
yes,
it'll be exactly the way it was before
it goes back to the same size unless you have very bad tears. But also things like Kegel exercises help quite a bit after delivery. So it's a routine thing.
For squatting and what?
Tensing the muscles and releasing, tensing
Got
and
it.
releasing.
Okay. Second question: How do you safely induce labor past the 40th week? So 40 weeks is usually the standard time for pregnancy, right?
Is EDD.
Is EDD, exactly.
Weeks, yeah.
So if after it has been, let's say this lady was asking, she's at 41 weeks, 3 days, and she was told she has to be induced by inserting a pill. Is this safe?
Well, there are many methods of induction of labor. The most common is a pill, a tablet, hormonal tablet that's inserted just behind the cervix. So it's quite safe, but there's circumstances in which you can use the different methods. But in terms of safety, you are in a hospital, the baby is being monitored, you are being monitored, any side effects are being monitored. So of course you don't do induction at home. So induction in a hospital
can you even get the pill?
Yes, you can. I mean, this pill is the same. I mean, some of them are the same ones you are used for terminating pregnancies. So they are available backstreet pharmacies over the counter. So don't
do it at home.
Don't do it at home.
Yes,
yeah,
exactly.
No induction at home.
Okay, so you said there are several methods of induction. Yes. So there's the pill. What else can they do?
There's what are called natural methods as well. Some people swear on castor oil. The thing that castor oil does, you drink the castor oil, it makes you diarrhea until you go into labor.
You diarrhea the baby out.
And then there is IV medication that you can get for induction of labor. There is what are called laminaria tents. They're like a type of seaweed that you put in the cervix. It absorbs the water. The seaweed swells and opens up the cervix. There's so many different methods.
So many. Okay,
and you can use a catheter as well.
That sounds like a whole video on its own.
Yeah, that's like a whole.
But I hear I personally gave birth. Both my babies were through CS, so I don't have experience like with the vaginal birth. And for both of them, I didn't actually go into labor.
Yes.
So, but I've heard people saying that when you're induced, it's more painful.
It is. I mean, the induction would stimulate stronger contractions, so a bit more painful. But nowadays we should not be in pain in labor.
I don't know why I'm making my face like this, like I've not given birth, but
we have so many things for pain.
Huh?
Yeah, so
okay,
should not be in severe pain.
Okay. Next question is about ectopic pregnancies. Is it possible for a gynecologist to tell when one has an ectopic pregnancy if I don't present signs?
Yes, from examination. So like for any disease condition, we follow some steps. So we start with history, like what has brought you. Do you have pain on one side? Have you missed your period? Are you having a bit of spotting? We start suspecting. And then we do physical examination. We check, are you pale? We are thinking maybe you're bleeding into the tummy.
Yeah.
Check your blood pressure, your heart rate. We think you're losing blood. And then we do a pelvic examination. You have a lot of pain on one side, so we're suspecting that you have an ectopic.
Yeah.
So you can make a diagnosis just on history and physical examination.
Yeah.
And then, I mean, we have facilities so you can do an ultrasound scan and it confirms the ectopic pregnancy.
So the ultrasound is the sure way to find
It's
out.
confirmatory, but sometimes, you know, it's an emergency situation. You don't have time or you don't have the facilities. Maybe you're in Mashinani.
Sharks or something.
Yeah. So you just from history and physical exam, you can make a diagnosis and go with that. Yeah, so it is quite possible to do.
So if you feel like you have any of the symptoms of an ectopic pregnancy, the ones which you've mentioned, like pain on one side, spotting and what, do go and see a gynecologist. The next question is about VBAC, which is vaginal birth after CS.
After cesarean,
Exactly.
yeah.
Is it worth a try? Is it doable, first of all?
It is doable. What most doctors don't say, I don't know if it's the financial element of it.
Aspects.
But what most doctors don't say, I mean, the success rate is as high as 75%, you know.
Really?
Yeah.
Even if you've
But
had
there's
2 CSs?
Even after 2 CSs, you can do VBAC, but much more risky. So
Not that I'm thinking about it. Hey,
we'd only try it for after one
CS.
one CS, and then there's various parameters we look at. So like if your baby is on the scan, estimated 3.5 and above, then we won't really be comfortable to try. If we find that the baby is upside down, the head is up, the buttocks are down, we would not want to try. If the placenta is on the lower side, we would not want to try. Or if you've never delivered before.
Yeah.
Yeah, so there's various, I mean, we put a lot of restrictions. We say
So for my pregnancy,
Yeah.
would you say that I can give birth? I can try.
You can try, of course you can try with 10 CSs, but the risk increases exponentially. Yeah. So after 2 CSs or 3 CSs, then the safest method would just be an elective CS.
Yeah. On that point, now that we're talking about it, my dad had told me that if you have two, like if you're giving birth via CS, you can only have 3. That's the recommended. That after 3 CSs, that's total number of babies now you've had safely. Yes.
Exactly. I've done even up to 7 previous scans.
What?
I mean, you know, it depends on your cultural background, ethnic background.
Yeah, because you can't now tell them we're not going to deliver your baby.
There are people whose standard is 10 children or 8 children, so you can't restrict them.
Big up to you if you're one of those, man.
Yeah.
Okay, next question is about episiotomy. So episiotomy is the cut that you get.
Yeah, that the doctor makes.
The doctor makes, to make room for the baby to come out.
Yes.
If you have an episiotomy during your first birth, does it have to be done in the subsequent ones?
No, not routinely. Even now, you know, before it used to be all first-time moms used to get an episiotomy. That's old school medicine now. Now it's on assessment, case by case. So like even the first one, it's not everybody that has to get. We just assess you during labor. So even if you've had one before, we'll check and see if you're dilating well and don't look like you're going to tear, then you don't have to get a repeat episiotomy.
Talking about vaginal birth just gives me such
cutting
shivers. I'm just like,
suturing,
like honestly, guys, mothers are just, hey, we are superheroes. Next question. A lady is asking, I gave birth to my baby 1 year ago and I had a tear, but it was Shonward vibaya. And now when she has sex, it's very, very painful. What can she do to rectify?
Well, we need the history in terms of what, you know, there's different grades of tears. You can have like grade 1 to grade 4 being the one that goes all the way to the anal canal. It's like the most severe form of tear. And then the repair, there's ways to repair it. So if it was not repaired properly, or you use the wrong suture, or you put too many stitches, didn't tie the knots well, then you can have chronic pain.
So that's what she's experiencing, is the
so
pain,
during sex, or pain even during your period, pain when you sit down.
Yeah.
So one of the solutions for her is called a revision of the episiotomy. So basically you come to hospital, the place is opened up, all the old stitches are removed, it's cleaned out very well, and then it's sutured neatly, and you know, just to bring back everything the way it's supposed to be. So a revision of episiotomy.
Exactly. So you need to go and see, whoever sent me that question, you need to go and see a doctor. And by the way, I'm going to leave his contacts in the description box down below, and also over here. I'm just going to put it here right now in case you want to save his number and just call him for an urgent consultation immediately. Yeah. Okay, the next question is there a myth in terms of related to having sexual dreams when you're pregnant? And this lady says she doesn't have sex with her partner right now, but she keeps having sexual dreams. Is that a thing?
I think she's having the sexual dreams because she's not having sex.
That is the problem. Girl, what's going on?
You know, they say that you dream about the last few things that you think about.
Yeah.
So if you're having sexual dreams means
there you
when
go.
you go to bed
Exactly.
with your husband, you wish you're having sex, but you don't have it, so then you dream about it.
And it's not a myth because it's actually happening. You are having the sexual dreams. So
There's no restriction on sex during pregnancy, unless you have problem, if you have any issues.
Yeah.
But I mean, sex, like exercise, should be until the last day.
It's true. Actually, like exercise.
It's not a disease. Pregnancy is not a disease, so we don't put that kind of restriction.
Have you ever been pregnant?
I have
you ever been pregnant?
I've seen so many
have
pregnant
you ever been pregnant? Thank you. Thank you very much. Next question. Is baby number 1 likely to come earlier or later than 40 weeks?
No way to tell. It's unpredictable. The only way you can predict when you deliver is if you're having an elective CS.
Oh yeah.
Even for induction, you can induce you today and you deliver tomorrow.
Okay.
So there's no fixed way.
So it just depends.
But for most people, by the time you get your EDD, you've gone into labor. So very few would need to induce after 40 weeks.
Okay.
Yeah.
You all right? Next question. This lady is asking about having a weak cervix. So she says, how is she supposed to have a full-term pregnancy if she has a weak cervix?
Okay, so what she's referring to is called cervical insufficiency. Some people, because of maybe you had in a previous delivery your cervix tore badly, or you had maybe cervical cancer, had some surgery on the cervix, or you just born with a cervix that's not able to hold the weight of the pregnancy. So with the cervical insufficiency, what happens in the second trimester, it's called mid-trimester pregnancy loss. When the weight of the pregnancy starts becoming big, then you have a painless drop. Like you're just sitting at home and then you just feel something coming down because the cervix is not able to hold. So for those kind of people, I mean, depending on we do a scan to see the
and then
length
the baby's
of the
alive.
cervix.
Wait, the baby comes out and your baby's alive, or?
You know, even after 20 weeks, when a baby was born after 20 weeks, then the baby can even cry, the baby will be so it's a big pregnancy.
This is very scary.
That's why we advise on starting clinic early.
Yeah,
start your clinic in your first trimester so we can pick up these things.
My.
But in terms of solution to cervical insufficiency, there is different types of stitches that can be put. The most common is called a McDonald stitch or Mac stitch. So we put around 13 to 15 weeks. It's put just a day case. You come and the stitch is put around the cervix basically to strengthen the cervix.
Okay.
Then we remove it about 37 weeks.
Okay.
For you now to deliver normally.
Okay, so if you have a weak cervix, then you need to go see a gynecologist immediately you get pregnant, right? So you can plan for that. Okay, someone else still about the cervix. What is the solution for an incompetent cervix? Is that the same thing?
Yeah, but incompetent is not used anymore in this day and age of politically correctness. You know, if you say
it's not incompetent.
If you say a body part is incompetent,
it's like according to who?
So now we use insufficiency. It's
Okay, fine. So it's the same thing. Yeah. All right. Next question. Can I continue breastfeeding while pregnant?
Well, you can. Few issues. One is nutrition. So you have nutritional demands are very high for breastfeeding, and they're also very high for pregnancy.
The baby, yeah.
So now you have a baby out, you have a baby in, and you have your own nutrition. So nutrition is a big issue. That's why most people would say now start weaning off the baby.
Yeah.
And then
but there are people who get pregnant like so quick after.
So quickly,
The baby is 3 months or 4 months, and
the purpose of family planning, of contraception.
Guys.
So we can spread out the pregnancies.
Plan.
So for them, the other issue is in the third trimester, when you breastfeed, there's a hormone called oxytocin which is produced in your body, the feel-good hormone.
Yeah.
Same one she's produced during
chocolate.
sex. Yeah. Which is
chocolate.
produced by eating chocolate. So when you breastfeed, you produce oxytocin.
Yeah.
Oxytocin also acts on the uterus. So it can cause irritation of the uterus and cause preterm contractions as well.
Okay.
So by third trimester, most people have stopped
okay,
breastfeeding.
Fine.
Yeah.
So you can continue until before the third trimester.
Yes, or just space out the children so that you're not in that situation.
Okay, but sometimes it just happens. You're like you're sitting somewhere, and before you know it, there's the baby. Okay, next question. What can a pregnant woman take for flu, seeing as they can't take medication? Is that true? First, is medication not?
No. You can't take medication. There is medication that's safe in pregnancy. So whenever you're pregnant, we advise that you either get it on prescription, or if you're getting over the counter, you tell the pharmacist that you're pregnant, so they give you something that's safe. There's lots of antihistamines which are safe, from Piriton to Cetirizine to Claritin. There's so many which are safe.
Okay.
But also we advise more on the home remedies.
Okay, so like take the hot water, exactly,
ginger, lemon, that kind of thing.
Yeah. So that's actually a myth. So then medication is not forbidden. It's just you need to be cautious about how you take it.
There's so many medications which are very safe.
Yeah.
Most. And then there are some which are unsafe. Like antimalarials, some painkillers, antibiotics.
Yeah.
So you should always ask.
Okay.
Yeah.
Are there specific foods that you would advise a pregnant woman to take during the first trimester?
A normal balanced diet. I think what's more important is
throughout the whole pregnancy.
What to avoid is more important than what to eat.
What should someone avoid?
Yeah. So in terms of avoiding first trimester, avoid liver, especially eating a lot of liver.
Why?
It has a lot of vitamin A, and vitamin A affects the baby, causes malformations in the baby. So even if you're, say, addicted to liver, then would advise maybe just once a week and a
That's
small
so weird
portion.
because someone sent me that as a myth and I was like, no, it doesn't matter. You can eat what you want.
First trimester especially.
You learn so much.
We avoid liver.
Okay.
We avoid deep sea fish, octopus, squid, that kind of thing.
Because?
Sorry, Ocean Basket.
Yeah, sorry.
It's not promoted.
Don't sponsor. Don't sponsor us.
We avoid raw fish or raw meat, so sushi is off the table.
Okay.
Yeah, and then vegetable patties. We avoid pre-cooked meats as much as possible. So like salami, ham, things that you just slap onto the bread and eat. We try to avoid that because of infections.
You're talking about all the things I
all
love.
the things you like. Second
In my
trimester is coming.
pregnancy,
Don't
what's
worry.
going to happen?
Yeah, and then of course alcohol and cigarettes goes without.
Okay, yes,
without
for sure.
saying, yeah.
Okay.
So everything else
just eat. So just keeping a balanced diet.
A healthy
throughout.
balanced diet.
Yeah, so that's a lot of fruits, a lot of vegetables, drinking a lot of water, protein, and healthy complex carbohydrates.
Complex carbs.
Complex carbs. You don't
carbs.
like carbs, but now. Okay, then someone else is still asking about the first trimester. What can she do to deal with nausea and vomiting?
Yeah, nausea and vomiting is part and parcel of first trimester.
Chukua tu nozi.
Most 90% of people have. So first is home remedies. Ginger is very good. Spearmint.
Really?
Yeah, wow. Spearmint, like spearmint gum or spearmint leaves.
Spearmint, ginger.
Yeah, that's very good. And then the type of food that you eat. If you eat very oily food, spicy food, chili food, rich foods, then those would cause more nausea. So we advise on more bland foods.
More bland food.
Yeah, boring food, small portions, and more frequently. So, traditionally we'll eat big breakfast, big lunch, big dinner.
Yeah.
So we want you to eat smaller portions, but more frequently through the day.
So you can keep your body
And then, of course, there's medication.
Okay.
Yeah, there's lots of medication for it as well.
Okay. So again, go and see your gynecologist.
See
the assumption is, I always advise women, immediately you find out you're pregnant, you should go and see the gynecologist
you should start immediately. So that we know it's a normal pregnancy from the beginning.
Yeah, exactly. So please go see a gynecologist if you haven't already.
Yeah.
Next question. If I'm planning to be pregnant soon, how do I prepare my body before? Is there like vitamins I should be taking, foods I should be eating?
So the pre-pregnancy, nowadays it's catching on in Kenya. It's called pre-pregnancy counseling. Before you just see the doctor once you're pregnant.
Exactly. Like, oh wow, yeah, it happened. It happened.
But now we advise that, maybe 3 to 6 months before you want to conceive, you come with your spouse and we do the general medical checkup, make sure your kidneys are fine, liver is fine, you don't have diabetes, sperm count is okay, your tubes are okay, just to make sure that we optimize you for pregnancy. And then also BMI is quite important because you're definitely going to gain weight. Some people gain up to 18 kgs in pregnancy.
30.
You gain 30
yes,
kgs. So you are not eating well.
I was not. Watch her too. Maybe the next one may do not. I'm going to happen anyway.
So we want to get you healthy. I want to get you in a good BMI before you conceive, and then we start you on folic acid, which is just standard, which you'll use even for your first trimester.
I've seen Pregnacare conception or something like that, like a Pregnacare which you take it before you get pregnant. Is that
okay? No harm.
What do they have?
Sorry, Pregnacare.
What does it have?
It has multivitamins. It has a lot of things, all the types of vitamins, folic acid, iron, and all that. But out of all those things, you may need only very few. So it's not harmful, but it may be a cost that is not justified.
That is not necessary.
You just need folic acid, which is like maybe 5 boba tablets.
Okay, yeah.
Once
so
a
3
day.
to 6 months before get. Okay, fine. On that note, by the way, guys, I'm not pregnant. Let me just say. But we have exactly like until now. I'm not pregnant. It's just that we are thinking about maybe having another child soon. So I'm like trying to prepare myself mentally for this whole thing, which is another reason why
you need the counseling.
I need the counseling. This is it. After this session, we are now going to counseling.
M-Pesa number will also be scrolling here.
No. Pro bono, man. Okay, someone is asking about HELLP syndrome. What is the likelihood I will experience HELLP syndrome with my second pregnancy? What is HELLP syndrome?
HELLP syndrome is a part of a spectrum of high blood pressure in pregnancy, what's called preeclampsia.
Oh.
So like HELLP syndrome is a severe syndrome in preeclampsia. So it affects how your blood is clotting, affects your blood level, affects your liver. So it's like a constellation of symptoms called HELLP syndrome. So with HELLP
Does
syndrome,
HELLP stand for anything?
Yeah, it stands for hemolysis, which is breakdown of red blood cells. So your blood level goes down and your bilirubin goes up, so you can get like jaundice and stuff. And then elevated liver enzymes, so that means your liver is packing up. So your liver is affected by the disease. And then low platelets. Platelets help you clot. So if the platelets are low, then you can't clot well. So you start bleeding from different places.
This is the first time I've heard of
HELLP syndrome.
Wow.
So it's a severe part of high blood pressure in pregnancy, or a severe form of it. If you've had it in this pregnancy, the recurrence rate is usually about 27-30%. So if you had it before, then you're already high risk for it. So then we see you more closely, and there's medication we put you on to try and prevent it from happening again.
So even more reason, again, we go back to the, if you're pregnant, go and see your doctor.
As soon as possible.
Be sure you give the gynecologist that history, because if you don't even go to the same gynecologist, they need to know that you had that before, Okay, next question. Is it a myth that at a certain age, if one doesn't get pregnant, then the womb kind of like creates its own babies?
The fibroids.
Hence fibroids. What?
So many risk factors for fibroids, one of them being delaying your delayed age at first childbirth. So if you're, in this day and age, careers are there, education.
Yeah, people are having babies later.
Yeah, people are marrying late, having children later, so it increases your risk of getting fibroids. It is one of the risk factors, it is true.
But is it because your womb is creating its own babies?
No, it's not really a baby, it's just
that's
hormonal influences that then you get. But it's a benign thing, so it's not cancerous.
So it's not cancerous.
Yeah, I think that's
but
very
it still
important.
would need to be dealt with in
there's medication, there's surgery as well.
Okay. Another question, and this one, by the way, I got from so many people. Can pili hurt an unborn child if a mom is constantly eating chili food?
No, it's a myth. Your intestines and your uterus are not connected, first of all. So what you eat, it has to be absorbed, and by the time it's absorbed and going to the baby, then it's not what you ate.
Yeah, exactly.
It's not the chili that you ate. So it's not that it'll burn the baby.
So no, your baby wouldn't be burned.
The only issue is now the acidity stuff, because in pregnancy acidity is quite common, and the chili, spicy food, then that would really irritate your tummy.
The baby. Okay, next question. What are the chances of an ectopic pregnancy recurring? Did we already answer this? No.
We
but
just
if
talked
I've
about
had one,
diagnosis of an ectopic.
So if I've had one, am I likely to have another one, or?
Depends on the risk factor that gave you the previous one. For example, if you've had tubal surgery or you've had an infection in the tubes, so there's a lot of scarring in the tubes, then your risks are higher, as opposed to someone who just got it without any risk factors. But overall, if you had an ectopic pregnancy before, then your risk is about 15% of getting another ectopic pregnancy.
As opposed to an ordinary risk of?
Ordinary risk of?
Like if I've never had an ectopic, what is my general risk of having? What is anyone's risk of having? Okay, so it is higher.
With no risk factors, less than 5%.
Okay.
So it's definitely high if you've had one. Then the risk is high in the next pregnancy.
The risk is higher, exactly.
Again, see a doctor as soon as you get pregnant.
I think with everything to do with gynecology, it's like it's very specific. It's very specific to the person, your history,
and
the things you've been.
Different.
Everyone is different. So even despite watching this video, do take time to go and see your gynecologist if you haven't in a long time. Just go make sure things are okay, because you need.
We get a lot of, phone consultations, and at the end of almost every phone consultation, but come in for a review or go to hospital.
Exactly.
We can't treat you on the phone.
Okay, the next one was about medication. I think we've already talked about that. Let's talk about my myomectomy. What is a myomectomy? And if I've had a myomectomy, can I give birth naturally? Okay,
so myo is like medical term for muscle, and ectomy is removal of anything. So hysterectomy, salpingectomy, removing. So removing a fibroid is myomectomy. So the surgical removal of a fibroid. So it can be done in
fibromectomy.
I don't know.
Why didn't they call me when they were formulating these names?
Myomectomy sounds better.
Fibromectomy. Yeah, it sounds so like a serious thing. Okay, So does it?
It can be done in different ways. You can have what's called laparoscopy, which is the common nowadays, the more modern method.
Yeah.
The three small holes on the tummy.
How do those things work? How do they remove the thing? You shrink it. Or
You
what?
can either grind it. There's a machine to grind it and remove it in small pieces, or you can make a small cut behind the cervix and remove it through the birth canal. So there's different ways to remove them.
Wow, medicine has come a long way.
Yeah.
Right?
So once you've had the myomectomy done, depends on the type of myomectomy. You have some where it's not so extensive that you go into the uterus completely.
Yeah.
If you go into the uterus completely, then you're considered just the same as a CS. So you're already a previous scar.
Yeah.
If you have a myomectomy where the fibroid was on the outer part, you don't even open into the uterus, then you can have a normal delivery thereafter. Yeah.
Okay.
Yeah. So the type.
So the type depends. So again, you still gotta see a doctor.
Consultation.
Our last question is about epidural. Is epidural safe, or can it affect the mom after birth?
So epidural is for pain management during labor. So it's the only way to have painless labor. Thanks science. So when epidural
Cheers, Baba,
is
to science.
we usually give it about maybe when you're about 4 to 5 centimeters. That's when now the contractions are proper. So when the epidural is given, the pain goes almost immediately, and you'll have pain relief for hours even after delivery. So even if you have a tear, even suturing the tear, you don't need additional medication. Some risks with it, of course, which the anesthetist would take you through, or the anesthesiologist. So one of the biggest risks is the blood pressure shooting because of how it interferes with the nerves. Yeah. So that you have to be on continuous monitoring for your blood pressure and all your other vitals. And then some people have a bit of pain or soreness at where the epidural was put in the lower back. For some people, you can get allergic reactions to some of the medications that were used.
Of course.
For some people, it may delay the labor slightly, about 2 to 3 hours. But I mean, that's acceptable.
Yeah.
And then for some people, because you're not perceiving pain, you may not be able to push as effectively as someone who's
you're
feeling
it's tiny,
pain. Then you're being shouted at, push. You may not be perceiving pain, so you may just be chilling.
Yeah, exactly. But are you still like awake? Are you still like very conscious, or does it make you like?
No. I mean, it only takes care of the pain.
Okay.
Yeah.
But also, is it the same as the one you get during CS?
No. So there's epidural for pain management, and then there's spinal anesthesia for anesthesia, now to numb you completely. So for some types of epidural, you can even walk around. It's just that you're not in pain.
So this one mine was spinal anesthesia.
Yeah, yours now was to numb you from just below the ribs.
Exactly. That was our last question. Thank you so much for answering the questions. Again, I'm going to put his details down below, including the consultation fees and where you can find him and his phone number and everything. I can give you phone numbers,
It's a fine.
But he's
so
married.
Call me
Don't call him. Him and his wife, usually they pick up the phone together.
I may pick up the phone, my wife
she
may
might pick up the phone.
Fine.
You never know. But thank you so much for watching this video. Please like it. If you do like it, leave us a comment. If you have any other questions that you would like him to answer, I'm definitely going to have you back again.
I'd definitely love to.
I think you're nice to look at, and I'm sure they are all just going to agree. And of course, subscribe to my channel.
I've always wanted to.
Exactly.
Welcome to
my
channel.
Thanks guys for watching. Bye.